Hi, I'm Colin. Welcome to Learnsomatics. In today's video, I'm going to show you how to release tight pelvic floor muscles using somatic movements and principles. So let's get started. So working position for this will be knees bent, feet flat, like so. Now, the first thing we're going to have to establish is that can we feel our pelvic floor contracting and relaxing? So let's do that now. So lie down on your back like so, and just place your hands on your belly. And in this position now, you're going to squeeze your toilet muscles. Let's call them your toilet muscles. Everyone knows what that feels like. So the muscles you would use to stop yourself from going to the toilet. So in this position, if you do that, if you kind of tighten your toilet muscles, you will feel the tension in the pelvic floor. And from there, can you kind of draw those muscles up into yourself? And then you will be very clearly contracting your pelvic floor. And you may even notice that when you do that, your belly tightens a little bit. And then just slowly let that all relax. And notice how that feels. So that's step one, getting a sense of how to contract and then let go of those pelvic muscles. So let's just do that a couple of times. So you're going to tighten the toilet muscles, the muscles that stop you going to the toilet, and you're going to draw them up inside yourself. And just notice, does it make your belly feel a little bit tight as well? And then slowly relax. And let's just do that one more time, tightening our toilet muscles, pulling up or drawing up inside ourselves, and noticing what that feels like. It does create a little bit of tension in the belly as well. So these two actions go together. Tight pelvic floor and tight belly go together. And then slowly let that all relax. All right, so now that we can actually feel how we can tighten those muscles and relax them, we're going to add a couple of elements to this to make the effect stronger of what we get. So take your hands and pop them behind your head, like so. And we're going to curl up a little bit. So bring the elbows in, curl up, pressing your back down. Pause here. Again, when you're curled up, you'll feel that this makes the belly tight as well. Now, press your knees together a little bit. This is going to make your belly tighten even more. And in this position, just hold this position with your back pressed down, your belly and your inner thighs tight. And in this position, I want you to squeeze the toilet muscles again and pull up and keep this position and relax those toilet muscles. So you're squeezing the toilet muscles, then slowly relaxing, and then you're squeezing the toilet muscles, pulling the pelvic floor up, and then slowly relaxing. And we're going to do that one more time, tightening all those pelvic floor muscles as you're in this curled up position, and then slowly let everything relax. Let yourself uncurl and let your head come down. So let's just do that one more time. Elbows in, curling up, knees together, belly is tight. And in this position, without moving, we're going to tighten the pelvic floor, draw it up, slowly release. Tighten the pelvic floor, draw it up inside, slowly release. And from here, relax to rest. Okay, so just take a rest. Let your legs be straight for a moment. So what we're doing there is we're differentiating the action of the pelvic floor from the flexion muscles of the trunk. Those two movements can get kind of wired together if we're constantly tight. So by holding one and turning the other one on and off, we can separate them at the level of our brain. Our brain can feel that they don't have to happen together. So hopefully after doing that, you should already be feeling a bit of softness in the pelvic floor. It should be feeling a bit more spacious, a bit more open. So another factor we want to tie in is the breathing. So we're going to do that now. Let's bring the legs to bent, hands behind the head, and this time we're going to curl up like before. Belly is tight, knees together, back presses down, and in this position you're going to tighten your pelvic floor again. So tighten the toilet muscles and draw them up and in, and just stay here and do 3 cycles of breathing in and out in this position. So holding the pelvic floor tight, breathe in and out 3 times. And then you can relax on an exhale. Let everything go. Okay, so we're going to repeat that again. We're going to curl up, press the knees together, belly is tight, tighten the toilet muscles, hold all of that, and breathe 3 times in and out, and then you're going to release on an exhale and come back to the start position. So nice and easy. Elbows in, curl up, knees together, press down, draw your pelvic floor up, stay here, breathe in and out 3 times. And now on our next exhale, we're going to come down, relaxing all efforts, like so. Okay. Again, just let your legs be straight and your arms be straight, and just notice how that feels. That should already be starting to feel quite a bit more comfortable in the bottom of the pelvis. It's a very nice feeling. It feels very relaxed. Come back into the position. Hands behind the head. We're going to curl up like so. Press the knees together. Squeeze our pelvic floor, the toilet muscles, draw them up inside ourselves. And in this position now, we're going to breathe 3 times in and out. And we're going to come down and relax everything on an inhale. Keep everything tight, the toilet muscles as well. And then come down, let everything relax as you inhale. Okay. Again, we're differentiating out the breathing pattern from the pelvic floor muscles. Let's just do that one more time. Elbows in, curl up, knees together. Feel the belly is tight. Draw the toilet muscles in, the pelvic floor up. Hold. Breathe in and out 3 times. And come down on an inhale. Let everything relax on an inhale. Okay, and rest. Let your arms down. Let your legs down. So again, it should just be feeling more and more comfortable through the pelvis, more open, more soft, less uptight. That feeling of uptightness should be releasing. And if you think about what you're doing with those toilet muscles, you're literally drawing them in and up. It's almost a perfect description of up being uptight, like our muscles are up and they're tight. Okay, so by releasing them, we can feel less uptight, more relaxed. Okay, so let's just do one last little variation on this to help us get a nice release. And what we're going to do is put it all together for 3 repetitions. So when you're ready, bring your elbows in, curl on up, back presses down, knees together, and tighten your belly and draw your pelvic floor up and in. Take a breath out. And then on the inhale, just come down, letting everything relax. And we're going to do this 2 more times. We're going to go into the movement on an exhale, tightening everything, and we're going to relax out of it on an inhale, relaxing everything. So on our next exhale, we're going to elbows in, curl up, knees together, belly tight, draw the pelvic floor up and in. And then as we inhale, we relax everything. And we'll do that one final time. Exhale into the movement. Draw the pelvic floor up and in. And inhale to come out. Let everything relax. Okay, lay out flat and take a rest. If you feel you need to repeat any of those movements, please do so. But for now, just check in with yourself and notice how that feels. If you've done that slowly and carefully and you were able to get a good sense of your pelvic floor muscles drawing up and in and then releasing, that should be feeling quite different in the pelvis and all the way down into the legs, into your belly, right in the center of the body there should feel much more soft, much more open and much more relaxed. So that's a nice easy way to use somatic principles and movements to release the pelvic floor. If you suffer from pelvic floor dysfunction, practice that once a day for a few days and see if it doesn't help you have a much better sense of that area and allow that area to relax and feel more comfortable. If you've got any questions, drop them in the comments. Don't forget to like and subscribe. Thanks for watching and I'll see you next time.